Trust, covering the year to 31st of March 2024. As you can see, that's a rather interesting slide to kick things off. My name is Ian Turner. I'm the Deputy Chair at Devon Partnership NHS Trust, and I'll be chairing today's AGM. We plan to spend about an hour going through various slides showing the activities that we've performed over the year. And there will be an opportunity for questions at the end. If you have any questions, just type them in the chat, and what I'll do is I'll pick those up at the end, deal with them if we have time, or we will organise for a response at a later date, depending on how the timing goes and how many questions there are. So today, the running order today is, I'll do the introduction as I'm doing, and then absolutely fantastic to have Dr. Finn Larkin, who's our Chief Medical Officer, Phil Mante, who's our Chief Executive Officer, and Nadine Tucker, who's our Chief Finance Officer, and they will run through some of the highlights of the last year. And then we'll move on to a section just talking about our people and our culture, which Phil, the Chief Executive Officer, will do. Then, as I say, if there are any questions, if it's time, we'll do some we'll cover some of the questions that come in. Before I pass over to Finn, just a couple of things. I just wanted to sort of do a little bit of a summary of the year and just pull out a few things. If we could move on to the next slide, please. It's been an incredibly busy year, as it has been across the NHS. It's been a successful year, but of course there have been challenges. To give an idea of how busy we are, our referrals are about 18% higher year on year, and that's and then if you look at all of our services, there is incredible demand. However, we remain totally committed to the idea of inclusion, co-production, and collaboration on everything that we do, and that remains at the heart of the activities that we perform, and we're very, very clear on that in everything we do. And as part of that, our community work is terribly important to us, and that is a growing area. We're working more and more with non-NHS partners, and that is reaping real rewards and benefits to our service users in the community. Of course, none of this just happens. It's all about our staff, and the staff at Devon Partnership NHS Trust have been absolutely fantastic over the last year. The commitment that they've shown has been second to none, and I'm constantly humbled when I have meetings with teams as to how they're working to give the best possible care and support to our service users. To give an idea of our success in this area, is 93% of our users would recommend our services to family and friends, and that is a very high percentage and right at the top of the list of organisations in the NHS, something we're very, very proud of, and our staff are very proud of. We have got quite a lot of new exciting developments and initiatives, which Phil will touch on as he goes through his slide pack. And then I finally ought to just say, and Nadine will touch on this, we have hit all of our statutory and regulatory obligations, and we work very closely with our regulators, who are incredibly supportive. And again, that's really important for us and for our service users. Okay, enough of me. Let's get, if I could pass over to Dr. Finn Larkin, our Chief Medical Officer. Finn, over to you.
Thanks, Ian. I'm Finn Larkin. I'm the Chief Medical Officer. If we move on, Danielle, to the next slide, that would be helpful. Thanks. So, as it says, it's been a very busy year. It's also been a very difficult year for many of our patients and carers who've been disproportionately affected by cost of living pressures over the last year. And we have seen a significant rise in demand, as Ian says, up nearly 20% over the last year. Despite that, our teams have done a fantastic job. We've hit many of the national targets have been exceeded, and I'll take you through some of the numbers in a slide or two. We have fantastic staff and fantastic teams, and one of the most important things we can do for our population is to continue to grow the size of our teams. So staffing is a particular priority and challenge for us to retain the excellent staff we have and to recruit more. And if we move on to the next slide, please. So out of area placements are a particular focus. So this is when a patient needs inpatient care and there isn't sufficient capacity locally, and they have to go further away to get that package of treatment at that time. This is a big problem nationally, and we've made very significant progress. Our intention is to get to zero, and I believe we will get to zero. There's some slides later that give a bit of detail, but we are down to less than a third of where we were 2 years ago in terms of using out of area placements. And there's significant pieces of work coming together, partly to help patients stay well and prevent the need for inpatient episodes, and then partly to ensure that when they need inpatient care, that they get the care in a timely way, and as soon as they're ready to go back home, they have that opportunity. So if we move on to the next slide, please. So there's a number of numbers here. So you can see in the top left that referrals are up over 18%. A lot of those are to our TalkWorks service, which is about a third of all our referrals. There's some numbers there on our inappropriate out of area placements, which have come down from over 600 2 years ago, significant drop in the last in the year preceding, and then down again to just over 200 in the last year, and we continue to make progress in that area. In the top middle, you can see a slide that talks about first episode psychosis. There's a national target that 60% of patients would be assessed and treated in a timely way in line with NICE guidance, and we achieved nearly 80%. Our psychological therapies are also exceeding national targets. The top right mentions the point that Ian made, which is something I think for our teams to be particularly proud of. 93% of our patients would recommend our services to family and friends, despite the pressures on the NHS nationally. There's a national target of 85, but most organisations don't achieve the 85, and I think it's a real testament to the commitment and professionalism of our teams to achieve a rating like that. We've had over 300,000 contacts over the year in terms of community contacts between our teams and our patients. So you can see there's a high volume of work being delivered. If we move on to the next slide. So our intention is to deliver services that are safe, clinically effective, and positively experienced by our patients, our carers, and our staff. Safety comes first. I won't list our 7 safety programs, but they get priority because safety does come first, and they're listed there. If we move on to our next slide. So physical health is a particular priority for us and our patients. It's well known that physical comorbidities are a particular problem for patients with mental health disorders and lead to a significant loss of life years and contribute to a significant difference in life expectancy. So we've got a particular focus on serious mental illness physical health checks. There's a number of challenges to achieving perfection in this area, and we're making steady progress overall. But what's been notable is that some of our teams have made fantastic progress. And the ones that have done that have generally done that by setting up dedicated physical health monitoring clinics, so that when patients come into contact for any reason, they have the opportunity for a thorough physical assessment whilst they're with us, and that we're equipped to deliver that. And we're continuing to grow those physical health monitoring clinics across Devon. We're also working closely with particularly primary care to make sure that there's good communication, that we're not duplicating work, and that we're working together across different providers to make sure that our patients are getting physical health checks and then appropriate advice and management of any physical problems that they present with. We've got a refreshed physical healthcare strategy, which has come out this year to cover the years ahead. And as mentioned, this is an area of particular focus. If we move on to the next slide. Our first response service, demand grows significantly now, taking more than 3,000 calls a month, and also directly accessible through NHS 111, which went live this summer. And we have a range of community-based crisis offers. Some of those are listed there. So patients that are already known to our services should all have a co-produced care plan, so they know who to contact and what to do should a crisis arise. And we also have walk-in centres, for example, like our crisis cafes, and of course the 111 system if anybody needs advice or support 24 hours a day. If we move on to the next slide, please, Danielle, thanks. So our learning disability services, we're also focusing on physical health checks, particularly for this population. And we've restructured our community services to make sure there's better equity and distribution of our offer across the whole of Devon. If we move on, thanks. And these are the artist renderings of our new learning disability and autism unit, which is being built at the moment on our Langdon site in Dawlish. This is a really good building, actually. So it's been co-produced with patients, carers, and our clinical teams. And I think the building looks very good and is on track to be open by next summer. And we'll know more, I guess, as we start to open those services and provide those services. It's part of a regional offer across 2 sites, which serves a broad area. If we move on. And our neurodiversity services have experienced particular rises in demand, so very significant rises in demand. And we've responded to that in a number of ways. So one of the things that we've done is co-authored online-based CBT therapy specifically for patients with autism and ADHD. And we have a very active team that are involved in national and regional communities of practice. We've also linked with the commissioners to make them aware not just of the recent rises in demand, but the projected rises in demand for the future. If we move on to the next slide, please, Danielle. Our patients have experienced significant problems over the last year. There's been a national shortage of ADHD medication. It's actually an international shortage, so it's not just the UK. And our teams have worked closely with patients to make sure that they're aware of gaps that are ahead, dates when the medications become available again, and options that can be used in the interim where medication shortages have affected particular patients. We have a Devon adult autism interventions team, which is now up and running and is delivering multidisciplinary training to expand the team and their ability to continue to offer that service. If we move on to the next slide, please, Danielle. Our perinatal services have been reaccredited by the Royal College of Psychiatrists, so that's a quality network across the country, and it allows the sharing of best practice. And we've continued to expand our community perinatal offer, and there will be a short video on that in a moment. And there's a focus on fathers and co-parents and making sure that they have, there's an online screening tool, so making sure that they have access to the proper support and agencies and that there's good communication on the wider offers that are available. If we move on to our next slide, please, which I think actually is a short video on our perinatal services. Thanks very much, and I'll hand over to Phil after this video.
There is a stigma around regarding men's mental health, especially when you have a new child. It's the mother that matters, you know, that's how I viewed it. It's the mother that matters, the child that matters. I put myself last. I think a lot of men do. I felt ashamed that I was feeling so low. There is no shame in it. It's new, everything's new. And if you're feeling low, reach out, get help. There is no shame in it, there is support out there. And I said previously, it's something I wish I had done sooner instead of letting it build up to the point where I nearly took my own life. So if you're in that place, don't feel ashamed. Don't be afraid. Reach out and seek the help.
Okay, thank you very much, Fintan, and welcome everybody to our annual general meeting. As Ian introduced me, my name's Phil Mantay. I'm the recently appointed Chief Executive for the organisation, having covered the role for the last 9 months. I'm absolutely delighted to be sat here doing my first annual general meeting as the substantive Chief Executive. And the first thing that I'd like to reflect on is the community mental health framework. which is on our next slide. Thank you very much. And this is something we've talked to at the last couple of annual general meetings, because this is a multi-year improvement programme which started off with national direction but has been very much picked up locally by our organisation, by our teams, working very closely with our experts with lived experience and also with our partners to really rethink how we can offer a community-based access to people when they need support and treatment. So this did come with some money, as we've talked about in previous years. It was good, but we could always wish for more. And with that money, we worked alongside partners, including general practitioners, an organisation called the Devon Mental Health Alliance, which is a voluntary sector collaboration of charities who have a particular expertise and interest in providing mental health support. And the whole idea is that we support people earlier and closer to their homes and communities, and that it's a very much a multidisciplinary focused approach, trying to avoid that old system where people would present to general practitioners. They would then make the best formulation and assessment and refer them to us as the secondary care provider. The whole idea is that we, with other agencies, get much further up alongside general practitioners. And if a secondary care referral needed that's fine, but actually, is there a different support offered that would meet people's needs rather than them waiting to be seen? That's the whole premise of that earlier intervention, as well as having some very specific specialist community teams that didn't exist in the past around eating disorders, personality disorders and rehabilitation. So working with the Devon Mental Health Alliance, we've created recovery practitioner roles who've supported more than 1,300 people since its inception. And that's either on a one-to-one basis or in group sessions. So if you think a couple of years ago, that didn't exist. So it's fantastic that we've now got that offer, and we are constantly evaluating to see whether we're getting this right or not. But we're not at the end of our journey here at all. I'd say we're only really in the foothills of it, because a lot of this is about how we change our approach to care and support as well. And that's where we are now progressing something called the personalised care framework, with the idea being that our offer to people should be much more tailored around their individual needs rather than passing them to our individual service offers. So that's quite a big change for us, and that will continue to take a number of years to support our teams in terms of the change in practice that we'll need to undertake. We talk about things called PROMs, which are patient recorded outcome measures, and they're really important, because in this framework and different way of working, we need to be able to assess whether the interventions and supports that we're giving people are actually helping them get better or not. And PROMs, patient recorded outcome measures, are one such way of doing that. So that's something that we can look forward to in the next 12 months to see develop much more. I think it's really important that we don't just say how many people have we seen, how quickly did we see them, but actually did we help them recover, get better, or actually do we need to be thinking about something different for that individual? So PROMs are really, really important. And we're also doing some work about a citizens portal. So this is about thinking about our digital offer and how we can offer patients access to ways of giving us information about themselves, which means the clinical interaction that we have with them is far more focused on the clinical need rather than collecting information. So another year of developing our community mental health framework, and I think the next 12 months will be an exciting 12 months around those areas as well. So if we could move on next, please, to talk about the Southwest Provider Collaborative, which we are a lead organisation in. This is a collaborative that stretches from Cornwall across to Dorset and up to Bristol, with Somerset in the middle. And we've been a lead in this for some time, and it's where we've had delegated responsibilities from NHS England to work with our fellow mental health providers across that footprint to provide specialist eating disorder inpatient services, our secure services, of which ours are at Langdon, and also their CAMS Tier 4 services that are provided by Livewell. So it's been another year of development in this space, and this is something for which, as an organisation, we get acknowledgement nationally on a regular basis. And this year we've had a new partner, Dorset Healthcare, join with their CAMS tier 4 service, which is very welcome. So keeping with the theme of children, I'd like to move on to the next slide, please, and talk to our collaboration around children and adolescent mental health services, because this is part of an integrated children's community service offer called Children and Family Health Devon, which again is something we've talked to previous AGMs about. We are collaborating with Torbay and South Devon Foundation Trust on this, and there's been some significant work over the last 12 months in particular in trying to move to the new service model that we've been talking about when we first started to do this, and the pandemic unfortunately got in the way of doing this. So we've in the last 12 months now moved to the integrated pathway offer that was the vision that we sold to commissioners when we were successful in winning this contract from Virgin Healthcare, who provided it at the time. So it's been another 12 months, I'd say, of quite significant change for those staff that work within Children Family Health Devon. But I think now, having landed those 12 integrated care pathways, I think we can start to hope for the future that we'll see that integrated offer that we were very much keen to offer to the population of Devon. So moving on, I think it's really important to acknowledge where there has been success and recognition. And the team who work in Children and Family Health Devon have been shortlisted for 2 national awards, one around mental health support teams in schools, and the other for something called Letter for Tomorrow. And Letter for Tomorrow is a project carried out by adults, young people, and people with learning disabilities from Devon who wish to offer help and hope to those who are thinking about suicide. So it's great when we get the opportunity to have our staff recognised for the great work that they do. The mental health support teams in schools is a fantastic innovation over the last couple of years. And we've got a really good stat here that over the last 19 months, you can see the significant support that's been offered into schools across Devon by that team, with a significant number of contacts directly with young people, but also offering support to the staff who work in the schools, who on a day-to-day basis are obviously facing the challenge that our young people have particularly seen since the pandemic. So I know that there are waves of investment into mental health support teams in schools. And I think with the last wave of investment, Devon is seeing something about a 70% coverage of eligible schools, which is great. And they also are thinking about how technology can be used to support people with mental health support needs, and something called Nova, an online app for younger children, is currently being worked on. So if we can move on to the next slide, please. And I'm going to move to adult services now. So we, off the back of the community framework that I was talking about earlier, we have continued to make some progress in reducing waiting times for adults in community teams, which is not insignificant. The thing that I have my mind on there is making sure that whilst we're improving the length of waits and reducing the number of people waiting, that we're also we've got our eyes very much on, are we also offering the level of access to people who need our support? And it has been a further year of continued pressure for those staff and teams that work in and around our ward areas. They are some of the most pressured and intense service areas that we have, and they don't always get a chance to join our calls and our team meetings, but I think I would say a particular thank you to them if any of you are listening, and if you're not, you might be watching this back on a YouTube posting. It's one of those areas where our demand is the most acute. It's one of those areas when people need a mental health admission that we often get an interface challenge with our acute hospital partners, with people waiting in emergency departments or being admitted to assessment units whilst we're trying to find an available bed. So many people are involved in trying to make that urgent care pathway work, and you have my thanks. In the adult services, I'd just like to recognise as well that our core adult teams are now offering psychologically informed group work, which is improving access to therapies and reducing waiting times. And also, as I've just spoken to, really around the wards, it's a wider effort when it comes to the acute care pathway, and we've been focusing on how our teams can be working together across our team boundaries just to make sure that our pathways are working to the best effect for people that need our support. Moving on to older people, it's been a year of recognition for the team that works in our ECT service, which I had the pleasure of going to see a couple of months ago, with a fantastic accreditation, which is really top notch and should be celebrated because it's not easy to achieve, and not many in the country get the level of accreditation that's been achieved. We have managed to start to think more widely about the dementia service support that we have. And we do have, I would say, a modest level of support now in the Exeter Mid and North Devon teams, which is good. But there's more that will need to be done around dementia support going forward. And the older adult teams have managed to make some headway in terms of reducing the community waits, which is fantastic. And the current average waiting time is 4 weeks, and they should be hugely commended for the work that they've done to reach that position. If we could move on. Just briefly, those first two bullet points really speak to that comment I made about whilst we put some modest additional resource into support dementia, this is an area of significant challenge coming, well, I think today and going forward, and we will be working with our commissioners and partners in the voluntary sector to be thinking about how we can be offering support to people with dementia, but also their families and carers as well, because it is a significant challenge, particularly in accounting with our demography. And the older people team would also like to celebrate the fact that they have a significant number of apprenticeships and learners across all the areas that they are responsible for. So that's a little bit from me so far. And at this point, I'll hand over to Aideen, our Chief Finance Officer, to take us through the accounts.
Thank you, Phil. Next slide, please. So 23-24 has continued to be a challenging year, both for DPT and for the Devon system as a whole. However, we are in a relatively good position. In 23-24, the Trust had a turnover of £403 million and generated a net surplus of £3.3 million before any impairment. The Trust was required as part of the Devon system plans to generate that surplus, and that was part of the whole Devon system achieving the acceptable plan. Key pressures continue to be agency staff costs and the out-of-area beds or private placement beds. The Trust is working with multiple agency providers to try and reduce both staff costs, and work is in place to reduce the out-of-area placements, which we've heard earlier on from Finn. I'm really pleased to say that we've delivered our public sector payment policy. This is where we are required to ensure that 95% of our invoices are paid to our suppliers within 30 days. This is particularly pertinent for small suppliers and ensuring that they get appropriate cash flow. We achieved this target in year. We expanded a number of services and had investment in a number of services, including perinatal, gender, the mental health and schools teams, which Phil has referenced earlier on, but also the Reconnect services, which offer support to people with complex health needs who are leaving the criminal justice system. Next slide, please. In relation to our capital plan in 23-24, the total capital plan was in the region of 13.5 million, and significant areas of investment include the electronic patient record system, the investment into the new learning disability and autism ward that Finn referenced earlier in the presentation, some estates works and IT infrastructure, and as well as the development of both the Exeter and the Torbay crisis cafes, where we have brought them into our Wanford site and our Torbay site and redeveloped areas to provide a clinic service there. I'm going to hand over now. You can see the full suite of our accounts in the annual report should you wish to visit them. I'll hand over now back to Phil.
Thanks very much, Aideen. So yes, back to me just to take us into the final statements before we come to any questions that you may have or any that may have been submitted in advance. So if we could move on, please, that would be great. So I'm going to talk a little bit about our culture and the focus that we have had in the last 12 months and indicate some of the future focus as well. So our people and culture are, to put too fine a point on it, the underpinning significant thing for us to really deliver great quality care and get good outcomes. So I'm very focused on the culture of the organisation, as is the board, and it's something that we work with all of our staff group and with our patients to and their carers to try and improve as we go through each year. So if we could move on, please. So our culture is significant in terms of achieving the strategy that we've set out on a page, but also the strategy talks to the cultural developments that we are focusing on in order to get to that ambition of delivering the best possible outcomes that we can for our population. So if we could move on, please. So we have focused over the past 12 months quite significantly on developing what we call a restorative, just and learning culture across the organisation. And there are many aspects to this, and compassionate leadership is one part of that. Creating a psychologically safe environment for people to work in is another. And this is something that we will come back to time and time again over the months and years ahead, because if we have an organisation where the culture is that people feel there is compassionate leadership, a psychologically safe environment, that they're able to speak up when they see that there are issues and be heard and listened to and can see action as a result of that, we'll have not to put a final point on it, a happier workforce, which is motivated, which leads to better care and better outcomes for the people that we support. So, and one of our ambitions is to create that environment where people feel supported and empowered to learn, and that we're always learning. And actually, failure is part of life, and how we deal with failure is really important. And how people then feel supported when things go wrong is really important part of our culture as well. So culture, it's one of the most important things that we'll be focusing on over the next 12 months. If we could move on, please. And part of that is demonstrated through our together approach. And as Ian said up top, and as Fintan will have referenced on a number of occasions as well, genuine co-production is at the heart of what we seek to achieve. Now, I'm not naive. I know we won't always get that right, but that's something we should continue to challenge ourselves on and improve on. And one of the things I'm really clear about over the next 12 months is that strengthening inclusion right the way through the organisation is one of the top priorities. So our collaborative approach through Together isn't just about working with experts with lived experience. It's also their carers, their families, our staff, and a wide stake of stakeholders and supporters. One of the things I'm challenging myself on is, have we got all the right structures in place to hear all of those voices? And that's something I look to strengthen as we go forward. The inpatient transformation programme and culture of care programme are two areas that we'll be working with our Together team. And the inpatient transformation programme and culture of care programme are key parts of the NHS England plans to enhance culture of inpatient mental health services. Programmes working alongside those with lived experience, such as our Together programme. Particularly the culture of care programme focuses on anti-racism, trauma-informed and autism-informed care, and people with lived experience will be central to this and central to our efforts to improve and get that better for people who work in and need support of our services. If we could move on, please. I'd also like to acknowledge some of the work that's been done through our Together approach over the last 12 months. And the Safe from Suicide team have worked with carers to co-produce and deliver something called Stronger Together training, which is training for carers and families and staff who are supporting people at risk of suicide and serious harm. And this is something I hear a lot about when people are discharged from our inpatient care. Families, mums, dads, spouses, children, all worried about somebody's suicidality. So seeing that this training is there to support people in some really difficult circumstances is great, and that it has been genuinely co-produced by people who have been in that circumstance as well. In the last 12 months, we also launched our carer strategy, and the team came to the board to introduce that, which was working in tandem with the triangle of care to improve the family and carer experience. So if we could move on, please. Just before we play this next clip, we were lucky enough to have Julie with us during the last round of our journey events that we did with staff. So the staff that attended those events are able to hear firsthand some of her insights into being a peer support worker. And we're very fortunate to have 50 peer support workers, 70 volunteers, and over 100 experts by experience who do paid work with us. This is an area that I think we should look to strengthen and grow over the coming years to get those valuable insights into how our services can support people better from their perspective. So if we could play the video, please, that would be great.
I struggled with my mood after having my eldest child. And then I also struggled antenatally with my youngest child. So I'd been under the perinatal mental health team myself. So I come with that lived experience. And I think that that's really beneficial to mums when you have somebody who might not understand exactly what they're going through, but does have a level of understanding and empathy, having gone through something similar, and can be there in more of a befriending capacity, and also provide a beacon of hope for recovery for those women as well. I think it can be really useful to meet with someone that has struggled and come out the other side. It's a real honour actually to share that journey with them. I always liken it to a car journey, and I say, you know, you're the driver of the car, but I'm very privileged to be able to kind of sit in the passenger seat with you. You get to pick the route, you get to pick the tunes, but I'm there and I'm sharing this bit of the journey with you, this kind of tough bit, and that's a real privilege. The thing that works best in peer support is being able to listen, being able to provide that time to that mum. And sometimes just having someone with time, just having someone that can listen, that has gone through it is just so helpful. And when you discharge that lady, and that lady is so much more well than when you start working with her, that just is wonderful. It's wonderful to see.
Thank you. So I'm now going to move on to talk about our people. And it goes without saying that if we don't have good people and the right number of people, then it's very, very challenging to provide the services and the level of service access that we would need to for our population. And our teams are truly fantastic. That said, some of the roles that we need are really difficult to recruit to still. So I know that puts more pressure on those fantastic teams. But I'd just like to acknowledge some of the progress that we've made around these new roles that have been established and recruited to. So with student nurse placements, nurse associate posts, clinical associate psychologists, and multi-approved professional clinicians across our inpatient wards, where we have a particular challenge in recruiting consultant level posts, we have a lot more diverse input now in through these different roles. And I think this is really important, that the roles obviously need to be suitable for the tasks that we're looking for them to do, but really bringing a sort of multidisciplinary mindset with people with different backgrounds and experiences to do the job that maybe more traditional roles used to do, I think is really going to be of benefit to wider teams, but also to the patients receiving care. So we're making some good progress in this direction, but it's something that we're also going to have to focus on significantly as we move forward. If we could move on to the next slide, please. So we've done something a bit different around induction in the last 12 months, and we have a Welcome to DPT Day to support colleagues who have recently joined the organisation. So the feedback that I've had is that that's a good initial orientation, but we probably need to think a bit more about how we're supporting people through their first year than we are at the moment. We undertake our journey events, which are our staff engagement events every year. And the year that's just gone, we've had more than 700 colleagues that took part. This year that's just gone, we did far more face-to-face than online. And in the year going forward, again, we're going to focus far more face-to-face and do a lot less online, because I think that interaction between the teams that are there delivering the R journey and the teams that are there participating is really important, and not quite the same online. Our staff awards are coming up again. In the last year, there were hundreds of nominations, and everybody that gets nominated gets an acknowledgement of a nomination, which is brilliant. So I always encourage people to do that for their teams and for their colleagues. And it's been another good year for DPT in terms of the NHS staff survey results. I always promise staff that if they complete it, we will look at it and we will look for the insights that it's telling us. It is completely anonymized, of course. So we can always do better in this space. When we benchmark along other mental health and learning disability trusts, there's above average for 4 of the 7 people promise themes. So what that's telling me is out of the people promise themes, we're above average in over half when it comes to staff morale. We continue to implement our ambitious People Together programme, but I know this is where we need to keep listening and where we need to keep including staff as we look to improve the environment and the working conditions and the culture that we're working in, because clearly the culture that I've talked about will be a big forming part of how people answer those staff survey results. If we could move on to the next slide, please. I'd just like to acknowledge, as we do most years, the significant input from our apprentices, and to celebrate that as an organisation, we do very well in terms of supporting apprenticeships. So we have 193 apprentices working across 29 programs. That is absolutely phenomenal. And when you look at the breakdown of that, 161 of them were clinical roles. That massively exceeds the national target for new apprenticeships every year. And a really key factor in all of that is that 95% would recommend our organisation as a great place to work. So if any of you are on the call who are in an apprenticeship, or anyone who supports them, fantastic. Thank you very much. And let's continue the great work. And I'd just like to acknowledge and celebrate some success on our next slide. So this montage here is a snapshot of some of the awards and teams and individuals that have been recognised. I'm sure we could do many slides, but I'm just going to do some call outs for a few of these. So the top row on the left-hand side are a group of trainers for our clinical associate psychologists, who won the HSJ, which is the Health Service Journal Partnership Award for Best Educational Programme. The top middle row is our SALIS team and simulation team shortlisted for the Patient Safety Awards at the Health Service Journal. The top row on the right photo, that's Kate Vickers, Deputy Manager at the ASU, honoured with the Carvel Trust Star Award for exceptional dedication in improving experience of families and carers during their loved ones' admission to the ASU, which is a very prestigious national award. Our middle row right photo is the simulation team again, I think. And our bottom row middle photo is Sabrina Garnowski, who's our Specialist Clinical Practitioner awarded for the prestigious Queen's Nurse title for outstanding service. So you can see that we've had at least a few people here in the last 12 months receiving really prestigious national awards, and I congratulate you again on those. So the very last slide that I want to do in terms of looking back is just to acknowledge our Bristol Dementia Service. And I think we've got a little video here. So our Bristol Dementia Wellbeing Service spent time with the England's men's football team in advance of the Alzheimer's Society International football match event on the 26th of March. They provided the players with the opportunity to experience some of the physical challenges faced by people living with dementia by wearing a dementia empathy suit, which I think we're going to see a short clip of now.
Would you be able to put your shoes on for me and tie the laces up? Stand up.
If you can pour some water.
Did it make it harder having your hands trembling?
Yeah, the trembling on the hands and the weights on the wrist.
And do you want to take a drink? Let's see how it feels. How does that feel compared to everyday drinking?
It was an effort to do it,
Yeah. Here's the football. Do you want to see if you can dribble that around? Was that a lot slower than you would normally do it? Yeah.
I feel like I've been dizzy and I'm a little bit unstable.
Yeah.
If you had to stay in the suit all day, how might it make you feel by the end of the day?
Disorientated, I think is the best word.
Yeah.
Not really knowing where things are, off balance,
Yeah.
can't hear anything.
Anxious,
Yeah. Yeah.
definitely. Probably very irritated.
I feel like you'd be very closed off.
Yeah.
If you was like this, you wouldn't really want to speak to nobody.
Yeah.
Thank you. And what an impactful way of raising awareness with a high profile group of people, but really, really meaningful as well to see, you know, what it looks like in terms of simulated impact for people who genuinely suffer on a day-to-day basis. So I offer my thanks to the team in their efforts to raise awareness. So if we could move on, please. I think we're into my closing comments now in terms of looking ahead, which I will keep brief. So if we could move on, please. So it goes without saying that over the next 12 months, we will look to take every opportunity to raise the profile of mental health, learning disability and neurodiversity, but also the resource needs that we have in order to meet the needs of people who need that support, not just in secondary care, which is where we are, but also across the wider system, because we will be working and do work with partners to think about the earliest possible intervention and where that is most appropriate. I think it's fair to say that we are in a slightly different period going forward now, and we're looking to see what the new government will produce around policy and direction, and we will obviously contribute positively and actively, proactively in that space as well. Really look as well to continue to support our staff as best we can, because as I've talked a number of times about culture, you know, creating that really good cultural environment where people are happy and safe, psychologically safe at work and feel they work in a compassionate environment, people will deliver the best care and the best outcomes for our population. And we will absolutely continue to strengthen inclusion right the way through the organisation and really build that meaningful co-production with people right the way through our organisation. So thank you very much for listening to those of us that had some information to share with you today. And this is an opportunity to ask any questions. This is obviously a public meeting, so there may be members of the public who have joined who want to ask questions, as well as a number of staff, which I can clearly see on the call as well.
Thanks very much, Phil. That's great, and thank you very much, Phil and Aideen, as well. As Phil just said, if anyone's got any questions, there's no questions in the chat, and I don't think we had any questions sent in before the AGM. But I'll just scan the room and make certain if anyone wants to say anything, put it in the chat or put your hand up. And also, there's a note in the chat just saying if you want to email any questions after today's AGM, please feel free to. And there's an email address to do that. Okay, so Jill, you've got your hand up. Would you like to ask a question?
I'm going to write it actually, so just bear with.
Okay, thank you very much. We'll just wait for that. Whilst we're waiting, just a very quick question from me, Phil, which is I realise I should know the answer to this, but
sorry, I am ready. I am ready now. Sorry.
Okay,
I don't know why I can't write it. So with TalkWorks at the moment, I may have missed you. You're not really seeing people locally in lots of areas, which I think is very difficult for people face to face.
So this is so the question is,
are you going to be providing again back to seeing people in their local areas with TalkWorks?
Right, got it. Okay, so this is TalkWorks and the whether there can be more ability for people to have face-to-face meetings in local areas. Don't know, Phil, is that something you want to just touch on, and then maybe Finn?
Sure. Jill, if there's a particular personal aspect to this, please get in touch with me. Obviously, I won't cover any of that now. So we do more online than we used to do. That was partly because of the pandemic, but also partly because of the pressure in GP practices for space. So we used to do a lot more delivery in GP practices.
But with that, I have attention deficit. You can go and use other places. Why do you have to use GP surgeries? That is the thing. To me, you aren't looking at other possible venues. You know, and that you know, I've got a friend and I myself would like to use the service, and you know that I mentioned it to a manager a few years ago, and as we were coming out of COVID, but nothing's been done on that. And otherwise, it's quite a long journey to go and see somebody, you know, by public transport. And also the places where they're at aren't the most lovely places, to be honest, either. To be honest, they aren't. That needs to be a bit addressed, I think, where you're seeing people. I don't know whether, you know, how that's going everywhere, but I think it needs to be less clinical, less professional, you know, so.
Okay,
well, are you going to do?
What we'll do is we'll take
more. I'm sorry to sort of be a little bit, but are you planning to do more on that, or not? Is that a plan in your report? In your report, is it there as something you're intending to do as a organisation? I suppose that's my question, really.
Thank you, Jill. So what we'll do is we'll take your feedback on that, and I don't have all that detail to hand in terms of the specific service plans, but what we'll do is we'll go away and make sure that we are properly looking at all of the different locations that we can be providing the service from.
And also when clients do feedback to managers, that hopefully that does, you get to know whether that gone to a meeting, you know, where's that gone to, because it's all very well doing that and then you're not told nothing, you know. And so, and another thing for me is I've been looking at your menopause policy and your sickness policy. They don't really coincide there for women, you know, so I'd like to see you being a bit better to women in their peri or menopause, or during their periods, a women policy through their reproductive health as well as an organisation, to reflag up and make sure also for staff and inpatients that that's. I'm sorry if I'm sounding a bit, but I am tired today. But yeah, and yeah, I'm a bit of a rush, but
that's fine.
Yeah, I mean, sadly, I know historically that hasn't been great. So
okay. Jill, thank you very much. Phil, you've got a few things to pick up on.
I'm sorry to say that, but there you go. Anyway,
no,
hopefully things get better. Things get better, then that's okay, isn't it? You know, so that's good. Yeah,
the only way as we talked about today, the only way we get better is by hearing these things and then listening and acting on them. If there's anything which is a bit more specific about geography, Jill, if you want to just drop a note into the email address in the chat, that would be really, really helpful. But
I have mentioned it to the manager, so hopefully something will change there, or that you'll liaise with each other and I can ask how that goes, can't I? So
no, that's absolutely brilliant.
All right, and thanks so much. Thank you. Sorry, I'm not nearby. I'm sort of in the middle of doing things, so sorry if I a little bit pushed in and just over spoke, but yeah.
No,
thank you so much.
Absolutely fine. Thanks for your input. Thanks very much. Thanks, Jill. Okay, any other questions for the team? No, that's terrific. So I'll just wrap up. I mean, Finn, Aideen, and Phil, thank you very, very much. That was a very comprehensive sort of coverage of what's happened over the last year. But also there's some good steers for some of the things that we're doing in the next year, which is really, really helpful. I think just to pull out a couple of things, just to sort of to summarize, it's been an incredibly busy year, and the staff have been absolutely fantastic, as indeed have our service users, and the way that people have stepped up to make certain that we do co-production and collaboration properly is just fantastic. The statistic of 93% of our users recommending our services to family and friends is one that we're rightly proud of. And a huge thank you to everyone for making that happen. There are, of course, that 7% who have said otherwise, and that's where the listening bit comes in. And we are very, very open. As Phil said earlier, we may not always get it right, but if we don't know, if we don't hear from our users and staff in those instances where it doesn't quite work out, then improvement cannot happen. So please, everybody who's on this call is involved with Devon Partnership, NHS Trust in some way, keep doing that speaking up. That was so appreciated. So I think on that note, I will literally wrap things up and we'll close down the AGM, the annual general meeting. And I'll just once again say a huge thank you to the team who presented today and everybody at Devon Partnership NHS Trust who have supported the team that have presented today, which is literally everyone in the organisation. So thank you very much and have a good rest of the day.